Dr. Priest, are you doing orthodontic work in your practice?
No, that's the one area that I don't. We take care of almost every other aspect of things, root canals, extractions, a lot of cosmetic work and fillings and things, but orthodontics I don't. That's the one area I refer out to specialists.
Well, all right, but since you're referring out to specialists, you are a dentist, and every dentist is qualified. It just then depends on that he says, look, I'll let somebody do the work which he does all the time only, but you obviously are licensed to do it, and you probably know about it since you're referring people out. So tell us a little bit about, the moms with teenagers out there, or for that much adults, of, what orthodontist fixes, when should young kids go to an orthodontist, and can orthodontics help an adult to avoid doing lots of veneers and lumineers and crowns and get the teeth straightened with ortho work? And what type of ortho work is available out there these days? Did it make improvements over the last decade or 2 or 3?
Oh yeah, that's the good questions. It's always best,
right? Lots of questions.
Lots of questions. It's always best to go see the orthodontist early. It's better to have him say to you, well, let's just watch him and have him come back next year, and we'll see if he's ready to get started, because the orthodontist likes to catch the child during the growth spurts, and each child varies and each condition varies. So sometimes they can put appliances in the mouth that will prevent having to have full-blown braces later on. So what's a shame is to take the child in at, say, age 12 or 13 and have the orthodontist say to you, boy, if you'd have brought that child in when he was 8 or 9 years old, we could have done such and such and prevented all these problems. So it's better to go early and have the orthodontist kind of monitor the case. There are some, like I say, I'm not as well versed on orthodontics as the orthodontist, but there are some new techniques and materials available that allow the orthodontist to bond the brackets on conservatively. They have special types of wires that require less adjustments than they did years before. And of course, the new thing is the clear aligners that people can wear. There's several companies available. The most famous and the first one was Invisalign, and that works well for a lot of people that have certain malocclusions. Some of the more severe ones still have to have braces and bands and things like that, but the Invisalign type liners work well. The nice part is you can take them out to brush your teeth each day and to eat, and so they're easier to keep your teeth nice and clean than trying to brush around those brackets. So that's an advantage. Your last question.
Yeah,
go ahead. Your last question about adults. A lot of people think, well, I'm an adult now. It's too old for me to have braces, but you can have your teeth straightened and moved no matter what age. And usually a lot of the orthodontists, a good percentage of their practice involves adults. And if you can move the teeth around and straighten them versus having veneers placed or having the teeth ground on, you're so much better off having natural tooth surfaces that are straight. It's easier to keep them clean, and it helps prevent gum disease if you can clean around the teeth properly.
Right. And, well, as you mentioned adults, and you also mentioned the Invisalign, which is basically, little, I don't know what you want to call it, but like it's a whole set of teeth, plastic, put over your mouth. And you mentioned that you can take it out, while eating. Which probably also means you can take them out if you have that, let's just say you're conscious about wearing braces, to that all-important business meeting or that first date and whatever it may be. So you could possibly take them out here and there for half an hour, hour or two, as long as you don't keep them out all the time. And I think that would work well for adults who here and there for some meetings self-conscious.
Right, exactly.
So that would be a good alternative. Well, all right. So anyway, let me ask you this, however. The mom has this 6, 7, 8-year-old child. Can she also come to you, and can you basically say, look, it's time for you to see an orthodontist?
Yeah, we're able to kind of help the patients know when is the time to go see the orthodontist, when's the proper time, or if there is a malocclusion that's beginning to form, we can kind of tip the parents off that your child's going to need braces in the coming years. So that's during their exams we can monitor those type of things.
Right. So it's okay to just like, for sure go to the regular dentist, ask him, make him aware of, and then the dentist naturally will anyway say, look, it's time for you to check in with an orthodontist here.
Yes.
Well, wonderful.
Yep,
Thanks a lot.
Thank you.